Welcome, everyone, to vpod.ai. This deep dive is sponsored by Stonefly, your trusted solution provider and advisor in enterprise storage, backup disaster recovery, hyper-converged VMware, Hyper-V, Proxmox cluster, AI servers, SA365, a turnkey security appliance, public and private cloud. Check out stonefly.com for more info.
Today, we're diving into a topic that, well, it affects a lot of people, but there's often a bit of mystery around it: throat cancer. We've gathered a ton of information to bring you the essential insights.
Yeah, our goal today is really to demystify throat cancer. We want to cover everything from some surprising symptoms, maybe, to the latest treatments and what life looks like after diagnosis. We'll dig into how it's detected, the role of things like HPV, which is a big one, and look at the different ways doctors approach care. Hopefully, you'll walk away with a much clearer picture and some really crucial knowledge, whether it's for you or maybe someone you care about.
Okay, let's unpack this then. Let's start with the basics. What exactly is throat cancer, and where does it usually show up? Sure. So when we talk about throat cancer, we're basically looking at cancers starting in either the pharynx, that's the tube running from behind your nose and mouth down your throat,
Yeah.
or the larynx, which is the voice box. Now, the pharynx itself has three parts: nasopharynx up top, oropharynx in the middle, that includes the tonsils, and hypopharynx at the bottom. The larynx also has sections. But the main thing to know is that most are squamous cell carcinomas, starting in those flatlining cells. And critically, the most common spot, that's the oropharynx.
The oropharynx, okay.
Yeah.
So middle part of the throat, including the tonsils. Why is that the most common spot? Is there a reason?
Well, yeah, and it ties into something we'll definitely get into later. A major cause is becoming more prevalent. But knowing it's often in the oropharynx helps frame the early signs.
Right, okay. So what are those early signs? You mentioned it could be kind of sneaky. What should people be aware of, maybe things that are easy to dismiss?
Exactly. Sneaky is a good word. What's fascinating and a bit worrying is that early on, it's usually painless, no obvious symptoms sometimes. But for oropharyngeal cancer specifically, the common one, you might notice things like a sore throat that just hangs around, or maybe a dull ache in just one ear. That one-sidedness is kind of a clue. Also, look at your tonsils. Is one bigger or shaped differently than the other? That asymmetry can be a sign. Difficulty swallowing, pain when swallowing, even a bit of blood in your mucus. Those are possible too.
That does sound tricky. I mean, a sore throat and earache, that could be anything, right? Allergies, a cold, strep. How do you know when it's something more?
That's the million-dollar question, isn't it? And you're right, almost all those symptoms can be something minor. The key really is persistence. If that sore throat or earache or whatever it is lasts for more than 2 weeks, or maybe you got antibiotics for suspected strep, but it just didn't clear up, that's the red flag. That's when you need to think, okay, maybe this needs a closer look, probably by an ENT, an ear, nose, and throat specialist. And don't forget dentists. They're often on the front line, spotting odd sores or patches during checkups.
Persistence. Got it. More than 2 weeks, or it doesn't respond to normal treatment. That makes sense. Now let's shift to causes. Most people probably think smoking, maybe EV drinking, but I've heard there's something else that's become a really big factor.
You've heard right. While smoking and alcohol are definitely still major causes, and seriously, quitting smoking is hugely important, especially if diagnosed. The big story in recent years is HPV, the human papillomavirus. A really significant chunk of throat cancers, particularly those oropharyngeal ones we talked about, are now known to be caused by HPV. It's an incredibly common sexually transmitted infection. So common, in fact, that estimates suggest around 80% of unvaccinated adults will get some form of HPV oral or genital in their lifetime. Most people clear it, no problem. But for some, years down the line, that past infection can trigger cancer.
Okay, this is where it gets really interesting and maybe a bit sensitive for some folks. HPV in the throat. How does it even get there? And if someone gets diagnosed with HPV-related throat cancer, does that automatically mean something about, say, their partner's faithfulness?
Right, good questions. It's mainly transmitted to the mouth through oral sex. More oral sex partners can increase the risk of getting an oral HPV infection. But, and this is really important, having an oral HPV infection says absolutely nothing about a partner's faithfulness or their number of partners. HPV is just so widespread. Think of it like the common cold of STIs. In some ways, lots of people are exposed without realizing it. And here's a crucial positive point. If the tumor is HPV positive, those cancers tend to respond really well to treatment. Patients generally have a better prognosis, live longer on average, than those with HPV-negative tumors.
That's definitely reassuring to hear about the prognosis, but what about the partner? If one person has HPV throat cancer, is their partner now at high risk? And the HPV vaccine, is it still useful if you're already, sexually active.
Okay, so partner risk. If one partner has HPV, yeah, the other has likely been exposed. But the actual risk of that partner also developing HPV throat cancer is extremely low. Very, very rare. Unlike with cervical cancer screening, there isn't really an effective way to screen partners in this situation. Regarding the vaccine, yes, it gives the best protection before sexual activity starts. But it can still be beneficial later. It can protect you against HPV strains covered by the vaccine that you haven't encountered yet. It just won't clear an infection you already have.
Okay, that clarifies the HPV picture a lot. So besides HPV and the traditional culprits, smoking and alcohol, are there other major factors we should know about?
Those are really the big three: HPV, smoking, and heavy alcohol use. And like I said, the interaction matters. If you have an HPV-positive tumor but you also smoke, your outcome likely won't be as good as a non-smoker's. So quitting smoking is just paramount.
Right. Okay. So let's say someone does get that diagnosis. What's the typical path forward look like from finding out to figuring out treatment?
Well, the diagnosis itself usually involves a combination of things. A doctor's exam, maybe some imaging like x-rays or scans, CT, MRI, PET scans. But the definitive step is the biopsy, taking a small tissue sample to actually confirm it's cancer under the microscope. Then they might do more tests on those cancer cells, looking for specific things called biomarkers, proteins, or gene changes, and checking if the cancer has spread. All this information, the type, the stage, biomarkers, spread, helps doctors figure out the best way to treat it. And treatment is very personalized. It really depends on the specific cancer, how advanced it is, those biomarker results, your overall health, and honestly, your own preferences too. Surgery is often the first step, especially for earlier stages. The aim is to remove the tumor completely, plus a little bit of healthy tissue around it as a margin. Sometimes this can be pretty complex surgery, maybe involving removing part of the tongue, or the voice box, or even the jawbone. If it's spread to lymph nodes in the neck, those might need to be removed too.
Wow. Okay. What about non-surgical routes? Are there other main treatments?
Absolutely. Besides surgery, you've got radiation therapy, chemotherapy, targeted therapy, and immunotherapy. And very often, it's not just one thing, but a combination. Maybe surgery followed by radiation or chemo and radiation together. Targeted therapy is interesting drugs like EGFR inhibitors. They're designed to attack specific molecules that help cancer cells grow, so they can sometimes be less damaging to normal cells than chemo, often used alongside other treatments.
Immunotherapy. That sounds really cutting edge. How does that work specifically for throat cancer? It sounds like boosting your own body's defenses.
It really is innovative. Basically, yeah, it helps your own immune system do a better job of finding and destroying cancer cells. See, cancer cells can sometimes put up signals that tell immune cells, nothing to see here, move along. They use these things called checkpoint proteins. Immunotherapy drugs, like pembrolizumab or nivolumab, are called checkpoint inhibitors. They block those don't attack me signals. This essentially takes the brakes off the immune system, allowing it to recognize and go after the cancer. It's a really powerful approach. We're seeing it used more and more for advanced cancers, recurrent ones, sometimes even before or after surgery, or combined with chemo.
That's amazing, harnessing the body's own power like that. So with all these advances, what's exciting on the research front? What might change things for patients down the road?
Yeah, the research picture is constantly evolving. Scientists are digging deeper into the specific gene changes that cause these cancers. Understanding that could lead to even better early detection, maybe even prevention strategies, and definitely new targeted drugs. Surgically, there's a lot of work on minimally invasive techniques, things like torus transoral robotic surgery, or TOVS, which uses videoscopes through the mouth. The goal there is to remove the tumor effectively, but with less damage to surrounding tissue, hopefully meaning fewer long-term side effects like trouble swallowing or speaking. And researchers are always testing new combinations, chemo plus immunotherapy, different ways of delivering radiation, trying to find regimens that work better and are easier for patients to tolerate.
That sounds really hopeful. But even with better treatments, life after cancer treatment can present its own challenges, right? What should patients expect?
That's a critical point. Finishing treatment isn't always the end of the story. It's vital patients get a survivorship care plan. This is basically a roadmap, summarizes the treatment they had, outlines the follow-up schedule needed to watch for side effects, recurrence, or even new cancers. And yeah, there can be long-term physical changes, things affecting how you eat, chew, swallow. Nutrition can become a real challenge. It's so important to report any new or lingering symptoms.
Let's talk more about those long-term effects, especially from something like radiation. You hear about dry mouth, but what else can linger for years?
Oh, definitely. Radiation, while essential, can leave a lasting mark. Permanent dry mouth, or xerostomia, is very common. and really impacts quality life, eating, speaking, even sleep. It increases risk for cavities, mouth infections, sometimes a burning sensation. In rare, severe cases, it can damage the jawbone, osteoradient necrosis. Then there's fibrosis. The tissues in the neck can become stiff, almost woody. This Lingett's movement can cause pain, even headaches. Trismus, or lockjaw, is another big one. Difficulty opening the mouth fully impacts eating, oral hygiene, dental care. Some people develop what's called dropped head syndrome because the neck muscles weaken. And stenosis, a narrowing in the throat or esophagus, can make swallowing persistently difficult. That's not all. You can have lasting skin changes in the treated area, making it more prone to breakdown or even skin cancer later. Lymphedema, swelling in the neck and face, can develop, feeling heavy, tight, sometimes affecting breathing or speech. Hormonal issues aren't uncommon either, like thyroid problems.
Wow, that's quite a list. Are there neurological or cognitive impacts too?
Yes, unfortunately. Some patients report cognitive difficulties, trouble concentrating, memory issues, what people often call chemo brain or radiation fog, even if they only had radiation. Nerve damage can happen, leading to pain or altered sensation. Years later, there's even a small increased risk of stroke-like events if major arteries in the neck were irradiated. Damage to nerves controlling the arm and hand can occur. Eyes aren't immune either risk of cataracts. Ears can be affected too, leading to hearing loss or dizziness. Even blood pressure regulation can sometimes be impacted. And though rare, there's always a small risk of developing a new secondary cancer in the treated area many years down the line because of the radiation itself.
That paints a very challenging picture of long-term survivorship. So, given all that, how do people manage? What's key to maintaining well-being?
It really underscores the need for lifelong vigilance and proactive care. Absolutely no smoking or heavy drinking. Maintaining a healthy weight, eating well, staying physically active, those foundations are crucial. For specific issues, there are management strategies. For dry mouth, meticulous hydration, saliva substitutes, sometimes meds or treatments like low-level laser. For trismus and fibrosis, dedicated stretching exercises are key, maybe physical therapy or myofascial release. And regular follow-ups are non-negotiable, not just with the cancer team, but dentists experienced with head and neck cancer patients, dermatologists for skin checks, maybe speech and swallow therapists. It takes a team.
And beyond the physical, what about the emotional side? That must be incredibly difficult to navigate.
Oh, absolutely. The emotional toll is huge. Feeling scared, anxious, sad, angry, it's all completely normal after going through cancer diagnosis and treatment. The most important thing is not to try and tough it out alone. Talk to someone, friends, family, clergy, a therapist. If those feelings of sadness or anxiety stick around for more than a couple of weeks or feel overwhelming, tell your cancer care team. They have resources, can refer you to mental health professionals. Trying to maintain some normalcy helps too, doing activities you enjoy, if your doctor clears it. Don't be afraid to ask for help with daily tasks if you need it. And support groups can be invaluable. Connecting with others who get it, who've walked a similar path, can make a world of difference. Organizations like SBOHNC, Support for People with Oral and Head and Neck Cancer, offer amazing resources and community.
What an incredibly thorough look at this. From those subtle early signs through the complexities of HPV, the advances in treatment like immunotherapy, and right into the real challenges and strategies for survivorship. It's complex, but clearly there's progress and support.
Definitely. And thinking about all this, it really brings up a question for everyone listening, doesn't it? Considering how our understanding of causes like HPV has shifted and how treatments are becoming more precise, how might this knowledge change the way you think about your own health? Maybe about screenings or the conversations you have with your doctor, even if you feel perfectly fine right now.
That's a really powerful thought to leave everyone with. Thank you so much for walking us through all of that today. And thanks again to our sponsor, Stonefly, your trusted solution provider and advisor for everything from enterprise storage and backup DR to hyper-converged clusters, AI servers, security appliances, and cloud solutions. Find out more at stonefly.com.
Thank you for joining us on this deep dive.